I'm Dr Srujana Joga, consultant medical oncologist at AOI Mangalagiri, Vijayawada. So today let's talk about bone cancers which can occur in any age group. So be it children, young adults or the older adults. Let's address common concerns among this population about bone cancers.
Myself Dilip Nandro, and my question is, what are the treatment options are available for pediatric sarcoma patients?
For pediatric sarcomas, that is for children, the treatment options available are surgery, radiation and chemotherapy. So for surgery, there are options for limb sparing surgeries because bone cancers are mostly commonly affect the long bones of upper limb and the lower limb, that is the arms and the legs. So these patients will be having concerns about their limb activity after the surgery. So by giving chemotherapy prior to the surgery, we can save the limb and the child can function normally and do the limb movements normally. So, and after the surgery, even though the limb is removed, there are good reconstruction procedures being done, as well as the prostheses nowadays which are available have a good function which function like a normal limb. So the other treatment option is radiation therapy in persons who are undergoing surgery and in which the complete tissue could not be removed, or if there are some microscopic margins positive, in those cases radiation will be given to some cases. And the third option is the chemotherapy. Previously chemotherapy was given after the surgery, and nowadays the standard of care is giving the chemotherapy prior to surgery because the bone cancers are usually a systemic disease. That is, they are not only present in the bone itself, they can be, small cells can migrate to the other parts of the body, which are called micrometastasis.
Good evening, ma'am. Myself, Sunita. My question is, can bone cancer affect fertility in young adults, ma'am?
Yes, bone cancer can affect the fertility. All the three modalities, that is the surgery, radiation and the chemotherapy, can affect, but the most common effect on fertility will be from the radiation and the chemotherapy treatments.
Myself, Ishwar Prasad. How does bone cancer affect bone health in older adults, madam?
So older adults are a special subgroup of people, and it's very challenging to deal this type of population because they have multiple comorbidities like diabetes, hypertension, and they are very frail and are at risk for developing fractures because of their decreased bone density also. And apart from this, if they develop bone cancer, maybe the tumor might be arising from the bone itself, or the tumor might have spread from other organs to the bone itself. Like the breast and prostate cancers, the most common site of spreading is to the bones. So to prevent all these, patients with bone cancers are dealt in a special way in elderly age. That is, we counsel first we assess the risk of the fractures of these patients by doing the osteoporosis predicting factor risk and do the bone mineral density scan, checking what is the chances of getting a fracture, and take a detailed history of previous fractures itself. And we should counsel them regarding regular intake of the calcium in their diet, as well as taking the vitamin D supplements. From the treatment wise, the patients will be given bone modifying agents in injectable forms to strengthen their bones so that there will not be fractures or their pain will be decreasing. So different ages bone cancers are different, and the approaches also need to be tailored to each and every individual. Like the children have to be dealt with utmost care, and they have to be given the option of limb sparing surgeries, keeping in their mind of their future growth. In the middle adults, the chances of fertility becomes an important factor, and the long-term effects of bone cancer should also be looked for in this age group. Elderly, the chance of bone fractures are high for bone cancers, and hence we should be watchful for that and take the necessary precautions.